Hello, everyone. Today we're going to talk about a very common illness that's affecting all age groups, especially teenagers. And joining me are two experts in the field, Doctors Pete, Dr. Catherine Pete, and Dr. Palmer Pete. And we are all going to talk about text neck, a pain in the neck. And I see this as my 50th year as a pediatrician in practice. And in the last 5 years, these kids, these young adults are coming in like they're hunchback, like old folks, they're hunchback. And they come in for a regular checkup. And I say to mom and dad, I say, your child's perfectly fine, but he suffers from text neck. Oh, wow. And if that doesn't get their attention, then I really get them. I say, your child suffers from cervical kyphosis. Cervical kyphosis. I don't know what that is, doctor, but it sounds like something I don't want my child to have. Cervical kyphosis is the bent over. And the real problem that we're going to talk about is this is occurring at the worst possible time in a child's life. When they're going through a growth spurt, when the neck is growing so fast, is when they're bent over so much. It just doesn't work. And it's not just a pain in the neck. The posture of your neck affects, for better or worse, the health of your whole body. For example, oral health. When you bend over like this, notice your lower jaw comes in and your upper jaw comes over, and you have an overbite, and the cavity of your mouth gets smaller. You develop an overbite and a mouth breather, and you develop what's called obstructive sleep apnea at night. You don't get enough air. And one of my most recent patients came in for consultation for ADHD. And within 10 seconds, when I saw this humped over child with an open mouth breathing and an overbite, I says, the problem's not in his brain, it's in his neck. And so Doctors Catherine and Dr. Palmer, tell us more about text neck. Tell us why it's such a chiropractic problem and has good chiropractic solutions.
Sure. So I haven't been at it for 50 years like you, Dr. Bill, but I've been a pediatric chiropractor for 38 years. And you're exactly right. When I first went into practice, you didn't really see a prevalence of this type of forward head posture where the child's head was forward. Tech necks can cause all kinds of things, including respiratory problems, puts pressure on the brainstem, can cause inflammation in the brain. We'll talk a little bit about circulation to the brain. I mean, there's been case studies been reported. I'm looking at one right here in front of me from JMPT that actually links cervical kyphosis. So you had mentioned that. And so for the watchers that may not know what that means, when you look at someone's neck from the side, there should be a forward curve towards the Adam's apple. So that's called a lordosis, forward curve. A kyphosis is a reversal of that, which causes a huge amount of pressure. So in this particular study, they had a child that had cervical kyphosis, that forward head posture and that reverse cervical curve. And he definitely had attention deficit disorder. He was not only on Ritalin, but also on Alderol and Haldol. And so he had 27 chiropractic adjustments. They worked on his posture, restored the normal curve, and with the consultation with the pediatrician was able to go completely off of all medication.
Wow.
That's a typical thing that we see when you correct the posture.
Mm-hmm.
Yeah, and one of the reasons too why we are talking about the brainstem a little bit, we're going to share that, but the brainstem controls all your autonomic nervous system. And your autonomic nervous system, for people, it's all those things that we don't really think about. So your heart, your lungs, like you said, the breathing, your sleeping cycle, your wake cycle, your body temperature, but also how you track different things. So with your eyes, how you're able to focus. So you mentioned ADHD, those people that are coming in, we have it there. We'll see some before and after x-rays a little bit later. But how can you focus on anything when you can't track the things or even trying to read anything?
Yes.
Focus from one letter to the other. It's really hard. So kids that have problem at school, concentrating or causing a little bit more trouble, being disturbance.
Wow.
Yeah.
So good neck posture can affect every organ in the body, is what you're saying, Dr. Catherine. Right, Dr. Palmer.
That is correct.
No, well, take us on a little tour of the body to see how this happens.
Shall we share the screen?
Yeah.
Okay. So let's do this and that, and I'm going to hit play. And here we go. So anterior head translation, which is the same thing as forward head posture, and a loss of the cervical lordosis or kyphosis, and the even worse thing, has definitely been related and associated with tech neck. You know, they did a study recently. They showed that 79% of the population between the ages of 18 and 44 have their cell phones with them pretty much all the time. Only 2 hours of their waking day is spent without their cell phone on hand, which is unbelievable. So it's simply a function of how much time we're spending on technology, either a cell phone or the computer or a tablet. So, you know, that kind of goes without saying. We're spending way too much time.
So Dr. Bill, you mentioned earlier that also it's important at the time that they're developing the normal lordosis, the forward head curve is right at the time that they're starting to be on their devices. So that's why we talk about belly time being so important for the kids. So they're looking up and not looking down, because that cervical lordosis
My
is
goodness.
developing.
So there's actually 50 or 60 pounds of weight on the neck at the very time that child is growing. Wow.
Well, we have a slide that speaks right to that. So, if you have normal posture with the head over your shoulders, your shoulders, this is for adults now. You're only carrying, on average about 11 pounds. But if your head comes forward even just 15 degrees, now you're carrying 27 pounds. 30 degrees is 40 pounds. 45 degrees, you're actually carrying 15 pounds of weight on your shoulders. This makes your neck and your mid-back work much harder, and actually even affects respiration, because you're literally compressing down on the lungs and affecting respiration because of this posture.
And what happens too is not only does it is like that when you're looking down at your phone, but by doing it so much, then it stays like that. It doesn't it does not come back to the normal.
Oh, I don't want to do that. I don't want to do that.
No, you don't want to do that. You don't want to do that. Here's the crazy thing too. I mean, radiologically, we're seeing, skull horns. So, there's been some interesting studies from this forward head posture and the nuchal ligament pulling on what's called the EOP, the external occipital protuberance. It's basically a bump that you have on the back of your head. Well, some of these, adolescents are actually growing a horn on the back of their head because they spend so much time. If you remember back from medical school, Wolff's Law, when you place a tension or pressure on a bone or load a bone, it's going to respond and grow. So this nuchal ligament from the forward head posture pulling on the skull actually creates new bone growth onto the EOP. It's crazy. It's crazy.
Crazy. That's a good word for it. Crazy. Crazy.
Here's another slide with the blood flow to the brain. So if you want to talk about some of the studies.
Sure. So for those, I think our watchers are going to be both physicians, but also lay people, if I'm correct. So physicians will know this, but lay people may not know that one of the main blood supplies to the brain actually comes through the bones in the neck. So if your neck is supposed to curve forward, that is the normal shape of the vertebral artery. So if your neck is reversed backwards, that cervical kyphosis, it's literally changing blood flow to the brain. And they actually did a study with this in the Journal of Brain Circulation in 2019. They actually, in their conclusion with the study, is they concluded that the results indicate a correction of a cervical lordosis. In other words, taking someone that has a problem in their neck and actually correcting it can be associated with immediate increase of blood into the brain and head.
Wow. And that Palmer was the study that got my attention the most, because one of the things we teach is every organ of your body is only as healthy as the blood flow to it. So when you bend over and lower the blood flow to your brain, and the brain says, straighten up, young man, I need more blood flow up here.
Sure.
So that was a great study. I'm glad you mentioned that.
Yes.
Yeah, and the numbers are not little. When you restore the cervical lordosis, it increases the blood flow by a minimum of 25% up to 225%. So all
Wow.
that lack of oxygen that the brain is not getting by having the forward head carriage is, like you said from your brain book, it's all about that inflammation that gets
Yes.
created in there.
Mhm.
And if you want to go with the next slide. Yeah.
Sure.
So this is a slide where you can also see the brainstem. So the red part here is the brainstem, which is the extension of the brain that we talked about, that has all your autonomic nervous system, that actually goes and exits in the first bone supporting your skull, called the atlas. So any type of misalignment there or pressure, and I like to compare that to a hose. When you put a kink in the hose, the blood flow or the nerve flow doesn't go the way it should, and that's what's happening. So any type of pressure, and I'm not talking about like tons of pressure that it needs to make a difference, any type of misalignment in the nerve flow or blood flow will create inflammation in the brain. And as we said, the brain, when it's inflamed, and you said in your book, right, and you've got depression, anxiety, ADHD, cognitive and memory functions decrease. So it's pretty serious.
So now, next, if I may, we're looking at a slide on the left-hand side, which has just the green solid arc. That's a normal lordosis. I kind of described lordosis, kyphosis. So on the left side, you can see the individual's teeth, you can see the back of the head, and you see that nice 42-degree arc.
Yes.
The X-ray on the right is basically an X-ray of someone that's got tech neck. So they have anterior skull translation, their head has come forward. It's just a fancy way of saying their head is shifted forward. And then they have that lordosis and sometimes even the kyphosis. So that this is an example of what someone that would have that posture when they had an X-ray, this is what it would look like.
Oh my goodness.
So when you come to PCH Chiropractic, we look at those X-rays, we take all kinds of measurements, not only between each bone respective to the one next to it, but overall, the overall curve and how many millimeters is your head forward and all this. And then from there, we look at what is the best course of action to restore that curve to the original, to the one that you really truly want.
And here's just another example. So this is cervical kyphosis. So rather than the forward curve, if you look on this slide, there's a slight reversal. And so this would be an individual, you know, there's a cause to every effect. There's a reason why your child can't focus. There's a reason why your kid may get chronic ear infections. There's a reason why that, you know, they can't sit still in school. There's a reason why, you know, this individual has headaches. And sometimes those can be associated with this type of thing that we're talking about. So from a chiropractic standpoint, because we're chiropractors, so we work to actually fix this, to correct it. So you'll see this, the slide on the left, the young lady with the ponytail, she's got anterior skull translation. And also you see in the kind of in the middle, it actually shows the model of that. So what chiropractic adjustment is given to actually restore the structure back to its normal alignment. And structure dictates function.
Yes.
If you don't believe that? Try screwing with a hammer or hammering with a screw. So the structure, if it's restored, then so will the function be. So chiropractic adjustment is given, and then also.
And then we also do traction. And this is a type of orthotic that we use for the neck that not only we do a different type in the office, but that's something that patients also do at home to keep on with the healing and keep on with stretching of the muscles and ligaments. And that helps to restore the neck curve. So you see it here with the device. And then on the next slide, you see an X-ray on the left with the person normally without the device. And then you see it with the dental roll.
Right. So that orthotic's called a cervical dental roll. And just so we're clear, the X-ray on the right is the patient laying on the dental roll. So along with adjustments, we'll give them a routine that they do at home care where they're actually laying on the dental roll, which does two things. It forces the normal lordosis back into the neck and also draws the head back so that the head can now sit back over the shoulders.
That's amazing. So the younger you start this, the better, I would imagine.
so much more. I mean, when you're starting with a child, and we'll see a case study in a little bit, I mean, within 7 weeks of adjustments and traction, the child had perfect curve, perfect lordosis. However, when adults come and see us and they're in their 40s or 50s and add to that trauma or, you know, car accidents, then that can take several months, or
Sure.
that will take several months.
You know, a beautiful thing is, and you know this, Dr. Bill, from your 50 years of practice, where there's life, there is hope.
Yes.
And anybody, whether you're 5 minutes old or 105 years old, everyone has the capability of healing. The body is always continually trying to rebuild, repair, and regrow itself. And but you are exactly right. The younger you can get to someone, the less suffering that they have to have, but also it's easier to correct. It's just much easier to correct. So
this is a case study, another case study with a child that was born by C-section. And when they went to the orthopedic, they didn't have any positive orthopedic tests. The only thing that they could find was a little bit of tenderness in the neck. But they were also on, they also had problems focusing, and they had a problem with ADHD. And after 7.5 weeks, which is so short, you know, it's not even 2 months of care and traction, then they had a perfect lordosis, and all their problems at school and at home went away.
so what, just so we're clear, what you're seeing on the left is the before X-ray.
Yes.
And then what you're seeing on the right is the after the interventions, like we just showed you, the adjustments, the traction, and then the dental.
It's interesting where the green, it just comes over and blends with the red. Amazing what it can do. Wow.
It is. And it's amazing the effect, therefore, it has on how relaxing the nervous system is. You know, imagine, you know, in your most tense moment, you can feel all that tension in your neck and your shoulders if you're stressed out about something. Well, individuals that have this posture, young or old, that's how they feel all the time. They're literally in fight or flight. Their nervous system is on edge continuously, and they literally, they don't even sleep right sometimes, Dr. Bill. Their ability to relax and get into REM sleep, that's even affected by all the tension they're carrying all day long in their nervous system.
Wow.
So we're excited you're bringing up this issue for your watchers.
Yeah, you know, okay, I'm motivated to start up like that.
Yeah, one trick for parents listening at home, just for young kids, because it's one thing to say, oh, text neck, and they should not be on their device, but reality is that they will be sometimes on their phones or tablets, is when they're at home, instead of having them on the couch, always slumping over, you can ask them to lay on their belly on the floor in order to do what we call in yoga like a mini cobra. So they're looking up when they're laying on their belly. So that way you alternate sitting and then laying on your belly, and that way that helps to relieve the pressure on.
And Catherine, I said this to one of our 15-year-old grandchild. That she had her tablet right in front of her. She was like this at the table. I said, honey, why don't you just go lie on the floor and relax and put it in front of you and like that. And it's amazing, a whole different posture just by laying on the floor instead of sitting on a chair.
Yeah, it makes a big difference, you know, just changing from one to the other and not always being in that position as well. Yeah, that would be great.
You know, sometimes I'll say to them, you know, just take a break. Say hi to the sky. Say hi to the sky. You know, keep your head. Say hi to the sky. You know, just go like that. And it's amazing if you just teach kids tools, as you say. They're not going to part with their cell phone. They're going to be like that. Best we can do is balance the forward with the good posture.
You know, we lived outside of Silicon Valley not that long ago, and many of the Silicon Valley-ites, their solution is they don't allow their kids on technology. They're the ones creating it, developing it, and selling it, and they don't allow their own kids to be on it. And so I would say another thing is just stay off of it. You know, take your phone away from your kids and say, let's play Uno. Let's
Sure.
play a game of cards. Let's go for a bike ride. Let's do something other than just all be in front of our phones.
Yes, and I did that for a family party. As you know, we have a lot of kids, a lot of grandkids. And I put a big sign as they came in the front door. Welcome to the fun house. Please deposit your cell phones here in the basket.
That's
Nice.
You know, I got a
good. I
little
like that.
kind of your old-fashioned grandpa looks. But you know what? The kids had fun. They had more fun. It
Sure.
was the adults who had the problem with it. So we you know, that's one of the things. That's what parenting is, teaching your children the tools to succeed in life. And what better tool is good posture? How's that?
That's good.
That sounds great.
We are so honored to know you, and we're so appreciative that you've included us in this important discussion. And we appreciate, you know, all you've done for all the families your entire career. It's an honor just to know you, Dr. Bill.
Well, thank you. And it's an honor to have you all practicing so close to our medical office, right next door, in fact. So thank you. And remember, parents watching that, as they're standing around, you know, say hi to the sky, let your ears be in the same plane as your shoulders, and enjoy that good blood flow to your brain. So we all wish you, from Dr. Pete, Dr. Palmer, and Dr. Catherine, Dr. Bill, a life of good posture. And thank you for watching.
Thank you.
you.